Hi, everyone. I'm here with Yvette Quesada, one of Operation Hope's financial well-being coaches from one of the Hope Inside centers. Today, I'm so excited. We are talking about overall health, physical, mental, and financial in celebration to Women's History Month. Welcome, Yvette. Thank you
Thank
for
you. Thank
joining
you
the
so much.
conversation with me. Um, can you tell me a little bit about the Hope Inside Center?
Of course. So I've been with Operation Hope since August of 2019. I specialize in credit and money management, homeownership, and foreclosure prevention. Operation Hope is a nonprofit financial literacy organization whose mission it is to disrupt poverty, equip adults and youth alike with financial knowledge, business development, credit and money management, and homeownership, to name a few. So I'm really excited for the things that are happening with Operation Hope. You should definitely make sure that you go onto our website, which is operationhope.org. Also, you can download our Hope in Hand app, where you can find a financial well-being coach near you, if it's not me.
Awesome. Well, it's nice to meet you, Yvette, and I'm so excited about this conversation. I'm Chaitra Dalton Bryant, co-founder of a company called The Art of Wellness. We are a wellness company that specializes in employee wellness and individual health coaching to help people find their space to how to be your best self. And we work with people on health coaching, nutrition, stress reduction, mindfulness, and so on and so on. I've been doing this business. I've been in a coaching business for 15 years, and I love it. I love helping people feel their best. And as we all know, that financial is a part of all of it. We have the physical piece, you got to stay healthy, you have the mental, mindful piece, and you have the financial piece, which, if people are not financially sound and feeling good, then the stress levels go up, the chronic disease starts to set in, and you can't function. And, that kind of happened to me. And I started the business because I got high blood pressure. Now, of course, I went to school, I studied nutrition, I did, all the educational piece, but along the way, I was, a CEO and started a company and was running around working really hard and wasn't sleeping, wasn't eating right. And sure enough, I ended up with high blood pressure. And I was able to apply what I know and was able to, after 2 years through integrated care and what I knew, to be able to get off of high blood pressure medicine and lose a little weight and, all the things that women always are wanting to try to do, but it worked. And once I realized the process of doing it, I started helping other people do the same.
Like you mentioned with the high blood pressure, last September, I was diagnosed with diabetes, and it runs in my family. I was put on metformin. I had to make some changes health-wise. My AC was 6.7. 3 months later, went down to 5.7. So, especially during the pandemic, right? You don't really think, oh, well, let me go get checked out. But I'm always kind of a stickler. If I have health insurance, guess what? I'm going to the doctor. I'm doing what I have to do. So that's something that I've been dealing with, and just doing things that I normally wouldn't do for myself, like acupuncture, which is something that was like, oh, let's try it out. And I love it. Acupuncture and cupping is my go-to now. I even bought a little acupuncture mat, like from Amazon, so I could do, in between my appointments.
Can you, even with, the finance piece, as we know, like in this pandemic, it's even made it worse. Like it's made people, the COVID has hit people financially. I mean, can you share some things financially that you've been seeing, helping coaching in the Hope Inside Center?
Mm-hmm. For sure. So I will say that maybe 90% of my clients are women that come through and are looking to increase their credit score and increase their savings and reducing their debt. At the onset of the pandemic, I had a lot of clients that had loss of income, whether that meant a total loss of their job or a cut in their hours. So that was difficult, but I actually saw an increase in phone calls. We did have the Operation Hope call center that were receiving calls because of the pandemic and being matched with a coach that was closest to them. So we did get a lot of calls, and so that was good, right? Because people were wanting to know about their credit, fix their credit, know how can I save? I wasn't expecting a pandemic to happen. I didn't have an emergency savings. How do I start one? So that is what I saw a lot of. Operation Hope then also initiated their first ever grant program that was assisting those clients that had at least 3 contacts with their coach, which would be like some type of appointment, and to be vetted to see whether or not they qualify for the grant program that helped with up to $500 with a credit card bill, a utility bill, or mortgage or rent. So that was also another way that my clients were able to get assistance and move forward from some of the things that they were kind of afraid of happening, whether that meant they weren't going to be able to pay their rent or things like that. Nowadays, I do still have clients that are affected by the pandemic in the sense of, maybe they are eligible for the vaccine, but they don't know where to go or how to get it. The information out there is a little confusing for them. So even though that's not something that per se is under my job description, that's still what's within me as a coach and as a person who loves to help people. I want to make sure that I do my best effort to find that information for them. So I will share COVID-19 resources, vaccine sites, testing sites. And so that's been what I've been trying to do, because I think ever since I was little, I've had a hospitable spirit, and especially being Latina and Puerto Rican, I think we have it in us to be, we want to serve, we want to make sure, we have guests come over, they're going to eat first. And so I've always had that in me where I've wanted to serve, I've wanted to help as much as I can. And if I can't find those answers, then I do reach out to my colleagues or to just other professional folks that I know and say, hey, this is a situation. I have a client that's going through this, but I don't really know how to help them, or reaching out to my strategic alliance partners. And so it's a team effort for sure. I couldn't do it on my own. And Operation Hope has helped me with, having some of the best colleagues that I've had ever in my, working professional life.
Super rewarding, but also it's women's history. And, a lot of times, women, we don't even still have the same equal pay, and we're advancing, and we need to know how to invest our money. How do we save our money? How do we repair our credit? Because a lot of us don't even know where to begin with, credit repair. Exactly. Or even the importance of credit in our lives and why we need it. And that's great, even with the health pandemic, that the health disparities alone. And, as our community, Hispanics, cancer is the leading cause, I think, of death in the United States. And, in African American women, it's heart disease. So these are the things in our community that we're suffering from. And it's, there's a stigma, low income disparities, like, what are we doing to keep ourselves healthy? Where do we begin to keep ourselves healthy? And are we even really just taking care of ourselves to start? Like, self-care is hard.
And it's never too late to start.
What'd you say?
Exactly. Oh, I was going to say, it's never too late to start, even if you feel that you're so far behind financially or physically that, where do I even begin? You begin by contacting Operation Hope and getting matched up with a coach who will walk you through the steps. For you, it may be baby steps versus someone over here. But guess what? You're both walking. You're both taking the stride to attain the goals of, having that freedom of, I have a 700 plus credit score. I have savings. I was able to reduce debt. I was able to move into a new apartment complex because I was able to increase that score. and then teaching that down to our legacy, which is our children, and saying, hey, I wasn't taught this, but guess what? I've learned this through, Operation Hope. I've learned it through other women, such as the Budgetnista or Clever Girl Finance, to be able to then teach my children so that they don't have to go through the suffering that I had to go through, because I didn't know, I didn't have the tools, I didn't have the resources.
Can you give three things, just 3 simple steps for someone out there, Yvette, that has no clue how to get started? Just 3 simple things that don't stress anybody out because you don't want it to make it complicated, that they can do today.
Right. 3 simple steps. I would say, first and foremost, if you really don't know anything about financial wellness or literacy, is to contact Operation Hope. We have services that are free for everyone. There's no cost. And then we will educate you. We will provide a credit report. We'll go through that one-on-one with you so that you know what this means and what it means to establish or rebuild the credit. The second tip would be something as simple as downloading an app to help you budget. So if you feel like, okay, well, how do I get started? You can just download, there's several different apps out there, and they can even sync up with your checking account or savings account. So it'll make it even easier for you to know where your money is going. And so the third one would be, I would imagine you also want to maybe ask other women, what they do. Or, it could be men too, but right now we're talking about women. If you see you have an aunt or friend that is, right, that is, managing their money well, even if they don't make a lot of money, right? So someone doesn't have to be super rich or well off to know how to manage their money, because there's a lot of rich people out there that don't know how to manage their money. So if you have a friend or a coworker and you say, hey, we work at the same job, we know how much we get paid, but she knows how to manage her money, you can just ask a few tips from them, kind of getting that conversation started. Like you mentioned, Chaitra, girl power, exactly, because, we have to stick together. Women's History Month is to talk about women that, have accomplished different things, but we also have to support one another, whether it's our mother, our sister, our coworker, so that we can, make it through together, because on average, women are paid less, making about 20% less than men working full time. Yes. And we're not expected to reach that pay equality for another 43 years. That's not right. Not good at all. So those would be my 3 tips. Yeah.
But if we know our financial literacy piece, and those are fantastic tips, Yvette, and thank you, because you know what, sweetie, if we know just 3 steps today that we can take, and we know financial literacy, then we will continue to keep getting ahead like we are now. And we will keep continuing to achieve and, thrive and get in our best places. And I'll piggyback off of, the financial piece, because, the mind, body, and the spirit all go together. And I'm just going to give 3 simple tips to piggyback off of the financial piece is, health-wise, we have to drink water. As simple as that. It's just drink more water. Drink more water today. That shouldn't stress you out. Oh my God, cheers. I have water too. I'm still trying to find my camera. But just drink water. It's a simple tip. It doesn't stress anybody out. It doesn't cost a lot of money. And the second thing I would say is get some sleep. That's just, the most important thing. If you can drink water and get some proper sleep, then, and the third thing I would say is, since we're on social media, and we're on Zoom and we're all sheltered in place, make sure you take care of your eyes. So every 20 minutes, look away from your computer screen and then stare away from it for 20 seconds and then come back to your screen. So I call it the 20-20-20. Eye health is so important too. So watch out for the eye strain as we continue. So, I hope, that everyone goes and gets their wellness checkup. It's, preventive care is the most important thing that you can do. get your wellness checkup, you guys, because you could have, a pre-existing condition, and if you can catch it early, it will never manifest. And, high blood pressure, thank God I caught it at a very young age, because, like I said, the heart disease and cancer are the number one, killers in our community, silent killers. So please make sure you get your wellness checkups. And so this has been a super fun, conversation. I would love to continue more because I can geek out about this and self-care, and my world is the wellness world. So you guys, I hope you learned some things. Thank you, Yvette. You're amazing. Thank you for all you do in the community. And we'll see you guys around. Stay well.